today, even under these most perplexing of moments in our shared history. On behalf of colleagues Naomi Baylor and Arista Janji, I'd like to formally welcome you to this session, which has been organized by UCSF's Decolonizing Global Health Working Group. And let me start by sort of restating what I've said at the beginning of our other sessions. The goal of these sessions is to explore and discuss how and why global health needs to change by asking hard questions about the work that we do, how we're funded, and the extent to which our research, the education, and the programs that we run perpetuate coloniality rather than advancing authentic global health equity. For most of 2021 and hopefully into 2022, we invited some really excellent thinkers who are trying to ask hard questions about the practice of global health. In what ways does global health education, research, and programs perpetuate asymmetries in power that exacerbate rather than redress inequities in health? How does coloniality still manifest itself at the global level in terms of institutions of power and funding and governance? And how can institutions like ours, like the University of California, address the impact of colonization on the work that we do, both globally and locally? In that context, I want to make it a practice to pause and recognize the impact of ongoing coloniality here in California, and specifically acknowledge that the land on which the University of California resides has been the home of different indigenous peoples groups for thousands of years. Here in San Francisco, the original people were the Ohlone people, are the Ohlone people, and I want to pay respect and gratitude to be here today on their traditional lands, and recognize that the Ohlone people are alive and flourishing here in San Francisco and across the Bay Area. I think there's a lot more that the university can do to address past wrongs and heal traumas caused here in California, as well as in our work globally. And the hope is that this group can be a venue for addressing how coloniality it continues to be perpetuated, and how we can address that. In that context, I'm particularly pleased to be able to introduce to you Dr. Muneera Rasheed. Before I introduce her, a word on format. She will be speaking for 20-30 minutes, and then we want to encourage you to interact and ask questions and share your perspectives. We welcome your input. None of us are experts in this, and so your insights are as valuable as others. And between myself and my colleague Arista, we'll be moderating questions in the second half of the session. Let me begin, though, by introducing Dr. Rasheed to you. I think it's about 9 o'clock in the evening in Pakistan. So thank you, Dr. Rasheed, for joining us. So grateful to have you here with us today. Muneera Rasheed is a pediatric psychologist by profession. Her interest is in studying how behavioral sciences can complement organizations in improving health outcomes. Her recent work includes leadership mentorship to engage employees for enhanced patient experience in tertiary care settings in Pakistan. And as a research scientist in the field of early childhood development, she also has significant experience developing, implementing, and evaluating responsive care interventions for children and families in communities, both in national and global settings. She is also a member of Action to Decolonize Health, an activist, action-oriented collective of global health academics, practitioners, and students coming together to put forward ideas, arguments, and strategies to reconstruct the global health system. And as it's relevant to today's session, Muneera is also the author of a really insightful and incisive paper published in the Lancet Global Health. Let me pull it up and put it in the chat so that you can all read it at your leisure, because it's quite a brilliant paper. entitled Navigating the Violent Process of Decolonization in Global Health Research, a guideline. To be honest, little has been written about how to deal with the complexity of North-South colonizer relationships in academia, particularly the violence that comes with it, and how this violence manifests in research collaborations between high income and low income settings. Dr. Rasheed writes in this paper that decolonization can only succeed if the colonized are willing to move out of their comfort zone and seize the opportunity to take responsibility for their own destiny. I'm going to, as I said, put this in the chat, not to distract you, but so that you have these at your to read at the end of our session. Because if you haven't read the paper, I would encourage you to do. In particular, I'd encourage you to also review the appendix, which I think offers us, collaborators, investigators, partners here in California, some tangible ideas on how to reduce violence in the practice of our global health work. So without further ado, Muneera, I think you're here. Thank you for joining us from Pakistan. Welcome. And I hand the proverbial mic over to you.
Thank you very much, Mike, and thank you everybody who is present today. It's really an honor, and I'm feeling stressed now seeing the number of friends. But let me just share my screen. Can you see my screen?
Yes, that looks great. And no need to feel stressed. This is a welcoming group. We're so delighted that you're with us. Thank you so much for being here. Over to you.
Thank you, Mike. Okay, before I begin, I would actually like to briefly explain myself, the position that I come from, and what do I talk about. I am a Pakistani woman based in Pakistan. I have no formal training in global health yet. And so I don't consider myself an expert in global health. The limited knowledge that I think I have accumulated over the last couple of years once I was going through these experiences. A lot of it actually conversations on social media, the people who tweet about it and who write about it. I'm really thankful and grateful. Yes, that's something that's helping me build my knowledge. I was trained as a clinical psychologist. My prior experience has been children with developmental disabilities. And that is something probably, I don't know, it's a blessing or it's a curse. I came, like you are trained with psychology when you're practicing, you hear the word empathy and it's like, it's hammered into you every day you talk about it. You don't call patients, we call them clients. It's not driven by therapists, it's driven everything by your client. You co-design with them, it's all about them, you're guiding them, and it's working together. I think that was a stark contrast that when I came into global health, and I would mostly when I'll talk more about interventions because that's where my work has been, and that's how I am, like my mindset is, so how do we fix it? So my examples would be around those. And I'm not going to present literature at all. I'm just going to talk about my reflections on my personal journey in the past 12 years that I was part of a university and how I saw the field from a very different lens. Maybe if I was trained, like I had a master's in global health, I probably would not have seen things the way I did because these are normalized. But I think I saw things which normally eyes wouldn't see, or I could hear things which were not said. And I felt things very deeply. And I think that's reflected in my paper as well. So broadly, the three topics that I touch upon is what's valued in global health. And that's purely based on my own observations. And it may be limited to what I saw in Pakistan or when I traveled. And what is my imagination of what I would like it to be, where the field should grow into, and what we all can do about it. So what gets funded in global health? These observations, these reflections started very early on. I was part of a study called Melody. It was in 2010 I got involved with it. $42 million study across 8 sites. One of the sites was Pakistan. I was a research associate. 2,000 kids. intensively and extensively followed for 2 years. And we also had, like it included a travel every year of 50 people. And I wondered if these are kids who are sick and these are kids who are malnourished, if you're trying to help them, is it the most efficient way of helping these families? Like, could there be other ways of doing it? It's just like there were like millions of data points and then probably 100 papers that came out of the study. Who did really benefit in the end? Were these some professors in the northern universities whose careers got a boost? My career also got a boost. It got me into the US for the first time. I got to network with so many people. But I think this is where I started questioning what actually global health research means. Who are we really helping? Who are the real beneficiaries? And I also saw the inequities and the obscene amount of wealth that can be hoarded, that can be present with one person, with one foundation, and how they choose to invest and how they choose to spend. There could be so many other ways of doing it. There can be so many other ways of providing support. But why do we choose to fund studies which are intensively data collection and which actually, which personally I did not see any benefit coming to these families? I also thought over time, is the bar for innovation in MIC, is it too low? Do we really need RCTs, randomized controlled trials, to figure out if school meal program is helpful for kids? Do we really need evidence? And then these are papers led by probably authors in the northern universities. Or is it because we think these lives are less valuable and this is the intervention, this is the innovation they need? And I don't have anything personal in any of the studies that I'm citing here. So I'm just talking about examples. And what is more valuable here? Is it the method? Is it RCT, that's the gold standard that gets into prestigious journals? Or is innovation also counts? Like, is hand washing, provision of hand washing station, is it innovative enough? And then there are plenty of studies around around water quality, around hand washing, around nutrition intervention. And I would think, do we really want to know this? If hand washing or nutrition intervention can help children? And it's tweaked in certain ways, like you have the same model and very simplistic delivery model. You have either community facilitators or research facilitators or your community health workers going out into the homes, into home visitation programs. And this is not just watch, I've seen so many interventions, and they go into the homes and teach these families and they come back, and there is no effort at least made to try to understand the complexities and the richness of these families. Even if they are poor, they have values, there are ways to take decisions, and it's not that knowledge is not there. There are books written around it, there is literature around it, but it is so much influenced by the biomedical model. It's like a physician or someone, a professor who's trained in public health or in epidemiology, who thinks they know the best and this is how we are going to do it. And over we produce a similar implementation models, which I don't know how are you going to sustain when we know that community health workers are not doing it anyways. This is a tweet I saw last year. It was by Lego Group, and it talks about they're selling a monument of Taj Mahal. And the first thought that came into my mind was like, but how many in India will actually have access to it? And I work in parenting, like my experience has been parenting interventions, and we give advice to families for homemade toys. So are these families, is this message for them, you should settle with less? Children in high income countries, they can go with Lego bricks and the most complicated and complex of toys, which can help their cognitive stimulation, the cognitive development. But what about families here in this part of the world? And I think if these mothers were as intelligent, or they had the time to, maybe they are intelligent, they had the time to produce such complex toys, we probably would not be needing these interventions. So what is this field in the end? Who is it benefiting? What is it coming to? And it's not just global health. I just came across a very interesting paper and it talks about academia actually, or the peer review process doesn't approve of innovative ideas. And in this study, they find that evaluators give low scores to research proposals that are highly novel. So there is certainly something that has to be changed, or the way we think about it. So what would I like it to be? My understanding is that the field operates on a model of sympathy or a model of pity. Like, these are humans who need to be pitied, or we are sympathizing with them. Here is something that we're giving you. You should just settle with it. And it's we are not mustering the courage to empathize with these families, because empathy means effort. Because empathy also means questioning the very structures that produce what Martin Luther King has said. It's not about flinging a coin to a beggar. It's about also thinking, what are the systems, what are the structures that keep on producing the need, and they're not making these people independent. And there are many, and I think the field of global health, at least probably that's my knowledge, we are not moving, and there's not enough intervention around structural changes. And it may not be an easy task to do, but then are we then supposed to do this research which is not probably helping these families anyways? For me, there has to be a clear theory of change. What are we trying to achieve? It has to be reduced inequities, not just in our part of the world, but probably in every part of the world. A report has been released recently, probably yesterday or day before yesterday, how there has been a billionaire produced every day, and 99% of the other part of the population, their economies have reduced. So these inequities are not just affecting us, but I think they're affecting everybody. And we have to think about how do we speak to it, or how do we act on it. And the core principle should be that all lives are equally valuable. If we change that value, I think there are a lot of things that can be changed. And this reflects, or this manifests in many different ways. It manifests in the way that we don't put in an effort to understand the needs of the families we are designing interventions for. It also reflects in the fact that leadership positions are limited to just white males, or into the fact that the investigators in my part of the world, or in LMIC, they are the ones who have to sacrifice. They are the ones who have to take, usually call at odd times. And I'm sorry, Mike, I'm not referring to you. This is time I picked myself. But it's also about the fact that we have, it is normalized, the patronizing behavior, the condescension that comes with it. It's not just from the high income collaborator, that as I write in my like in my paper in Lancet Global Health, it's been normalized in my institutions, in our countries as well, that it's okay to pay it. I think that's a core principle that has to be shaken somehow. And the intervention then that those are designed, this is when they will stem from a framework of structural changes and more sustainable changes. This is when we start thinking long term. So, what can we do? I think we have to reflect who is at fault. And when you ask people, the answer is the system is at fault. But then who is the system? Are we not part of the system? Are we not the system? Are we not the ones sitting on editorial boards? Are we not the ones part of the prestigious commissions, prestigious uh, review panels that are reviewing? Are we not part of the faculty in these universities? Are we not into leadership roles? So are we not a system for many people? And I think the question is then, who will build the system? That's the larger question that we need to ask. And the answer probably is, when you ask yourself, I always wondered why someone would do something about that, is the realization, am I the someone? That should be followed by, if you want to be the someone, why do you want to do it? And it's really thinking about the long-term versus short-term benefits. Do you want to lose a bit every day? Or do you want to risk a victory on a different path? Do you want to create a system that is fair and that's just? Every person that you meet in academia will load the system. They're upset the way the grant system functions, the way the publications are, the way people get into these journals and high impact factors. But yet, very few will be willing to then question the system, even when they have the opportunity. So are we willing to be that someone? What can we do about it if you are willing to be? And there are 3 steps to it. I think the first is acceptance. It is wrong. And not that what is going on is wrong. You see injustice going on. In keeping silent about it also wrong. But I think that honest introspection and acceptance, I think this is how Mike started with as well. That acceptance is the first step. The second is having conversations about it, just like we're having now. Write about it, use social media, take part into conversations, join communities, join activities, collectives, hold webinars. I think the third one is the most important one where you can have the most impact. Take action in whatever role we can as editors, as reviewers, as students, as chairs, and practice what we preach. And when you're ready to do that, do you think the world is going to love you? I mean, everybody says they hate a liar, but try to be the one who will tell the truth and the system starts getting violent. And how do you reduce that violence? I think some of it, what I wrote in my paper, is what I want to reflect here as well. If there are students here who are attending, I think also for the collaborators, we have to be mindful of the privilege, be respectful of the collaborators team and principal investigators. And being mindful of the fact that it may be just a matter of luck where you are in way your investigators or the research associate from the low middle income country, or it could be the other way around. If I talk about my country, there are very few opportunities for a PhD, and I think even rare for a global health, like PhD in global health. So that's the reason I have not been able to yet achieve one. And that should not be a reason why someone's knowledge or competence is being questioned. And another notion or another belief that people have is science is not just about conducting RCTs. I know it's important path to evidence, like obtaining evidence, but also engaging humans to get work done, to understand what their values are, to understand how they function, what their behaviors are, what motivates them. That in itself is science. And those softer skills may be the harder science. There's a reason why guidelines are created easily, but implementation of the guidelines or uptake takes probably more than 10 years sometimes, because that's the harder science that we have not invested in. And for those students, don't upset when your collaborators start vocalizing the concern of their priorities. And I also seen where students actually override decisions taken by the site PI for whatever reason, or if they're allowed to, but be mindful of the fact, and don't believe everything that your PI is telling you. I have been there when I have seen the world through the eyes of my PI, and probably that was due to maybe my loyalty, my naivety, I don't know, but I have suffered. And academia is a very cutthroat field, and people, I mean, what the story they tell you may not be what they benefits them probably. And if you want to request comfort, if you want to request people to be supportive of you, but then be willing to do the same as well. If you request a 5 a.m. Pickup, actually that's a paper that's been published in a journal. And then the title of it is like 5 a.m. something, I can't recall now. But then you have to be willing to do the same as well. If you expect people to do their call in odd hours, then you have to do the same as well, and you can alternate call hours. For the collaborators in HIC settings, I think lay down partnership rules at the outset. Be supportive of your collaborators. Be mindful of the fact they don't have access to libraries, they don't have access to statistical packages, they don't have opportunities to build their competence. Understand the operations, dates or field visits should be mutually decided. It is always good to introspect and seek mentorship and any stage of your career, even if you're a professor, especially when it comes to human interaction, when it comes to collaborating and partnership, there is always going to be friction. And if there is no friction, there was no partnership at all. Then there was just one point of view. And if you think it doesn't work out, I think it's better to part ways gracefully if those things don't work out. Relationships matter, and they should matter, and sometimes more than achievements. There is more that comes later, and there is a lot that you can achieve if you're trying to be in an equitable partnership. But I think sometimes we do require mentorship or someone who has been there to guide us along that. And I would say the same thing when people are used to privilege. I think equality starts, it starts seeming as an oppression or as a discrimination, and it may be uncomfortable, and it may take time, but it's okay. I think understanding some of those processes and the discomfort that comes with it, and taking responsibility of getting things done well, probably that's part of is to reduce violence. For institutional leadership, I don't have much notes. Maybe this is something the group can suggest to me, but I think they have a much larger role to play, which I haven't yet seen. Because these collaborators in HIC, they are driven by their own incentive system. They are driven by they are pushed to do things which probably they may not have done if there was that pressure. For example, I have seen grants where they have to they have the pressure to keep a lot of funds on their side as well. And when they have nothing to offer, it's just to travel. I was part of a grant, which is about $3 million grant, and 1 million was just travels from HIC to the field side. And it was capacity building, but probably, and we had very little amount to the government partner who was going to implement the study. And maybe that pressure was from the fact that they also have to show some numbers within their own universities. These universities, I think these leadership people who are in leadership roles, they have a role to mentor their staff, to mentor their faculty, and also keep an eye on their faculty and mentor them and to think of ways of influence beyond abuse of power. And let me be honest, I think the most influential way of influence or most powerful way influence is when you can abuse and you don't abuse power. And why not just choose the other way? Like, why should always be, why should it be coercive influence? It's important to request feedback from my collaborators. And I would again say, it's not about penalizing anyone. I don't want to hold individuals responsible for something that, because individuals are driven by the culture that we have created. It's the and we have the responsibility again to create that culture or to create a new culture where these conversations become a norm and where we find new ways of doing things. Institutional leadership or the investigators in LMIC, they also have a role to play. They also have a responsibility. They also have to strive to create a culture of mutual respect in research collaborations. We have to train our investigators. I think it's the colonial mindset that we have, that we have to be the ones sacrificing, or we are not comfortable, confident in voicing our concerns and opinions. I think that confidence has to come from your institutions that you are part of. And when your investigators come up with concerns, listen to them and make them feel heard. Sometimes that's all people want. Step in where needed to support and navigate challenges and mentor them to be future leaders. And I feel like we have not yet realized the value that we bring to this global health research. If the majority of work is on the field sites in this part of the world, then these collaborators and these universities need us, or they need it for the research as much as we do. And there is a point where you're not vulnerable. Like there is a point where you can actually negotiate. It just requires some effort, and it's going to be uncomfortable, but someone somewhere has to do it. For investigators, again, because this is where I come from, this is how I'm speaking for like that language, I think we have to learn to communicate assertively, especially written communication. Since our universities and our institutions, they don't provide a lot of opportunities, we have to look for opportunities and we have to invest in our capacities. The culture, the working conditions, the intellectual stimulation is very, very different as compared to a high income setting. And that's something I used to crave the most when I used to travel is the kind of conversation that you can have in intellectual stimulation, the ideas and the collaboration that you get. And I did not have that in my institution in our part of the world. I think that's very important. It's important to build our own community. And relationships matter when things get violent. And it's also because I think the way that the world is moving towards now use of social media, there is plenty of opportunity that now social media presents or Twitter presents. And whenever there is an opportunity, strive to bring something of value to the table. It's not going to be like a token, like you're coming from, like you are here just to represent someone, a woman from, or like a woman from Pakistan, LMIC. No, I want to bring something of value to the table, and I'll find ways to bring value to the table. If it's about intellectual inputs, if it means reading more, I'm going to do that. If it's about doing the operational stuff, I'm list about sending emails, it's okay, I can do that. Because everybody like there's no free lunch, and there shouldn't be. We all have to contribute and contribute, and we have to question as well, what is the value that I am bringing and where can I bring value. Some of the lessons that I learned was during that process is don't wait to convey your concerns to your leadership. I think start a conversation, and it's not about pointing fingers. It's about yourself. It's about what the difficulties that you're facing and what is it that they can offer you as means of support. Because if you don't speak to them, they cannot support you. Don't trust anyone. This is a lesson I learned as well. Trust your team, but not completely as well. And you have to keep your checks and balances. And don't expect the world to be fair. When you are vulnerable, the things won't work out as you would want them to be, but don't give up. Things may be difficult. The path that you choose, when you choose to speak, there will be violence. People will question you. You will be scrutinized more. But there is always light at the end of the tunnel. The fact that I'm sitting here talking to a group of 56 people, it's the fact that things do change. There was a time in 2019 when I felt like everything would actually end. And I was on a travel and I felt like I would harm myself. And it was so stressful, and I had to text a friend and ask him to call me because I was feeling so stressed out. But today the world is different. It's just a matter of 2 years. So don't give up. I think most important step is also get organized, be part of a community, be part of a collective, and get unified. This is a quote from, I think, by Ben Phillips. He tweets a lot about inequality, and I really loved what he wrote, especially for the academics. Evidence is not going to be enough. Policy proposals are not going to be enough, and you may take a few seconds to read it. I think we all have to get together, understand how power is maintained, how we can challenge it, and where does the power of the common man lie? In one individual. There are plenty of examples in the history. Just power of one individual, the belief or the conviction of one individual can really change things. It's just that you have to go to believe. I would like to end my talk here. And since it's a university, and I'm not sure if there are students here, but if there are faculty here, the way we are training our students, we should not be training to be conformist. They should be the ones who question us. They should be the ones who are activists. They are the agents of change. They are the ones who will make this world a better place. So we have to encourage the talks and some conversations and difficult conversations for them to continue this. Thank you.
Muneera, thank you. That was a really really excellent summary of some really insightful advice to us. So thank you for taking the time to share from your own experience. I would love to give opportunity for members of the audience to share their own perspective, ask questions of Muneera, and so now is a great time to do that. We want to sort of assert that, you know, none of us are experts in this domain. Many of you have lived experience or insights from your own work that we would love to hear from. But maybe I'll start, Muneera, with just a question around the role and responsibility that we have here in California to advocate for some of the things you talked about, and I think something we've also heard from some of our other speakers is the need for humility, whether that's epistemic humility in how we answer research questions, or humility in how we engage with partners, given that by virtue of where we come from and the roles that we play here in California, we have power, and there is power imbalance. How can you create, in your mind, how can we do a better job of sort of creating that posture of humility as we engage with partners from LMICs and in global health? Do you have any insights for us?
I think there has to be a greater role of the institution itself, and behaviors have to be incentivized, and we have to focus on the positive side of behaviors. And let's talk about how do we create equitable partnerships. I think, and some of the ways are, maybe have training for your staff. Empathy training sometimes works. It could be there is something that people are not even aware of what they're doing or how they're coming across when you're so used to that privilege. The other is, I think mentorship is really, really important if I think about it. And I don't know how it works in high income settings. Is there mentorship training or mentorship in practice with your staff, and what does it entail? Does it really talk about the power imbalances? Does it speak to them how do you how do you engage with the individuals who may have been and who grow over time? Like if these are long-term partnerships, like they may be 5 years, 10 years, 15 years, maybe 2 decades sometimes, and people who have been working with you, they may have started as an assistant and associate, but then they grow as colleagues, and they will question you and they may challenge you. And I think there will be challenges, and understanding that equitable partnerships will require effort from the individual, but also from the institutions in terms of mentorship, but also creating a culture where we have these conversations over and over, and we bring up examples of equitable partnership. We recognize and we appreciate how does it look like. The most powerful I find is the culture, and the culture is where you think it's not acceptable now for me to do or for me to behave in a certain manner. A lot of it is the people who are in the leadership roles. What do they value and how do they value, and do they really talk about equitable partnerships within their own institutions, with their own faculty?
Yeah, thanks for that. I totally agree. We have a comment or a question from Nadia. Nadia, do you want to take yourself off mute and share your perspective? Thank you.
Hi, Muneera. We are Twitter friends, but we haven't met in person. The power of social media. And I just want to say thank you so much for your very candid presentation, where you're putting in, how you've gone through things professionally and personally to a degree. And one of the things you've said, which I think really strikes me as extremely important and bingo, is saying that we should not be training people to be conformists. And anyone who knows me from childhood to this point, it's like, why do you never ever go according to rules X, Y, Z? But not in a manner to be showing bad behavior, but to make things better and challenge the aspects of the status quo that may not be helping us. So what, standards do not mean conformity. I think when you're in a profession, you want to maintain standards, right? But that doesn't necessarily keeping to conformity and not being open to change. One thing I'll add to also what you said is that, and I've learned that over time, is that you've said different things, but I'll add, we shouldn't put all our eggs in the institutional basket. Do not put all your eggs in institutions, because institutions are inherently self-serving and inherently, I think, will sacrifice individuals for the institution. So while you work at an institution and do well to hold them up, find people, as you said, your community, who will be made up of individuals who may be at 1 or 2 or 10 or 20 institutions. Think about it. The best people you work with, if they left their institution today and went to another institution, would you still collaborate with them? It's going to be probably a yes. So you're really not, benching on the institution, but more the individual who brings value to themselves and to the institution and to the work. So thank you very much for that.
Thank you so much, Nadia.
Yeah, thanks, Nadia. I totally agree. That's a great comment. Your comments around the WASH research that you were involved with, and the utility of that raised some opportunities for discussion. Would you be willing to speak more to how we decide what questions need to be studied, versus when we should trust or follow the knowledge that we already have, particularly local knowledge, and how should this define global health agenda more generally? Do you have any insights for us on that, Muneera?
More than the research question, I think it's how you design and how you implement your intervention studies. I'm seriously, I've seen so many papers, so many interventions following the same model. You design a training manual, it's colorful, and you send a home visitor to those families and you give them advice. And in 1 year or 2 years' time, you see a change, and then you say it's effective and the government has to take it up. Well, that's not how it should be done. That's not how behaviors are sustained. Probably you need a much more nuanced understanding of how these families are functioning, what their beliefs are, what their decision making is. If they're not washing their hands, why not they washing their hands? It's not because they don't have the knowledge. And someone going to their home and asking them to do it or asking them to play with their child, it's probably the principle that's working is reciprocity. And you build a relationship and they feel obliged to follow what you're asking them to. I think the larger culture around them, the system around them, and being more cognizant of the context that they live in. You have families who don't have access to pipe water. They have to walk miles to get water. And to ask them to be so mindful and washing their hands this many times, it's not just about someone conveying them, it's about making it easier for them, creating an enabling environment for them, and creating such interventions, designing such interventions. I think it shouldn't be difficult. We should probably move away from the biomedical model of fixing things. It cannot be someone sitting in their ivory tower and has its foundation the misfortune of the people, like, and in this part of, like in the disadvantaged areas. It should be really empathizing with these families, thinking about how does their day look like, and if there was no piped water for us for like a day or 2 or 3 or a week, would our hand washing practices change? I think they would. Comfort and pleasure. I think this is what we are studying when we started clinical psychology. These are the two principles that human behavior functions on. We seek pleasure and we seek comfort. And if you can find that within your intervention, if you can design that, then people are much more likely to do that. If the pleasure or the prestige is around publication in a high impact journal, this is what people are going to do. But if it's around what impact have you created, what capacity have you built, have you created independent leaders on the site, how many first author papers or last author papers have you given them, has it changed over the years? If that is what the prestige becomes, and by default you will see people moving or running towards those incentives. So this is, I think we have to work around, I think, a larger picture of how you want to fix things, or the urge to fix things. It is going to be a patient and empathetic framework of doing it.
Yeah, thank you. I see that Serena Rodriguez has raised her hand. Serena, would you be willing to take yourself off mute, introduce yourself, and then share your insight, comment?
Yeah, thank you so much for presenting today. I work in California as a researcher for community engagement, and I really want to uplift what you have just said about really what is the purpose of research, and what is the purpose of an individual publishing a paper. Is it to get into a high impact journal with good, strong results? And I actually argue that community engagement, which sounds more what you're working with too, is just, you know, engaging the community on their level, on their terms. That creates better science. That's my argument. And I get flack for that. I have scientists come to me saying, if we start being selective of who we pick, that damages the science, the validity. And I argue the other way of, you know, I'd rather have good quality relationships with these folks, because that's how you do build trust, and that's how you build other projects. And if you give funding and compensation for your partners, you know, you can work more synergistically and get that better science. And so I really think that the quality of the science will be better when we as academics embrace the fact that science can be mutually beneficial. It can uplift, it can, you know, we can make it whatever we want. It doesn't have to just be about prestige. And yeah, I really wanted to thank you very much for speaking today.
Thank you so much, Serena, if I pronounce it right. I totally agree with you. I think we also probably have to think what actually science is, and how do we define science? Is it always about a cluster randomized control trial, or engaging community? Isn't that science enough as well? Is as prestigious as well? I think these are the conversations we also need to continue having.
I see that Christopher has raised his hand. Christopher, would you be willing to take yourself off mute and introduce yourself and share your comment or perspective? Thanks.
Yeah, hi. Thank you so much for giving this talk today. And something that I brought up a few different times that I was hoping to ask about was around the idea of the individual versus the institution. And you mentioned during your talk how researchers in low-income or low and middle income countries don't have access to the same types of trainings or library access. And we see this all the time in the work that we do. And as the University of California, there are things like the online Masters of Public Health program, but they aren't necessarily open to those that we are working with. And so I was just wondering, from your perspective, being in engagement with researchers from the global north and like trying to build reciprocal relationships, what would you see as a more equitable future for all research colleagues to be seen as those that are training and working, and what trainings should be available through these institutions that we can turn to as individuals that want to benefit both sides of that relationship?
Thank you very much, Christopher, for attending the talk and also for your question. I think there can be many different ways to do it. I know some universities that offer like guest studentship, and they give you a university ID, and then you can also access their library and access their statistical packages. That may be one way to do it. Inviting them for training is one way, but I think the most powerful is mentorship. And what I feel is probably the incentive for these individuals or collaborators in HIC is how they mentor the research associates or the staff within their own university. Hence, it's not prioritized that individuals who are on the site and who are way too busy with the operation, they really don't get time to even if there is opportunity for a training course, it's very difficult to pull out yourself from the operations and then take time to be attending a training. But if we could incentivize mentorship of your partners, of the people or your collaborators that you're working with, I think that's another way of doing it. People won't mentor until the institution requires them to do it, or until their own performance or their own KPI depends on mentorship of the staff on the ground. So I think this is something that we have to probably pressurize our institutions or stress that this has to happen so that we start mentoring these individuals.
Yeah, agree. Hardwiring requirements for sort of more equitable relationships, as you mentioned before, sort of has to happen at the institutional level, and that includes access to training and you know, resources that Christopher's referring to. Thanks for that, Muneera. Maria, would you be willing to share I see your hand is raised, your comment or perspective, and introduce yourself as you come off mute? Thank you.
So, sorry, I didn't get you, Mike.
Oh, I see Maria's hand is raised. I'll let her introduce herself.
Okay.
And share her comment.
Can you hear me now?
Yeah.
Hi, thank you. Hi, my name
Hi.
is Maria Lopez. Nice to meet you. It was such a powerful message that you have. I just wanted to ask you a question. I am a physician from Mexico. I am currently in my first year of PhD at UC San Diego and a joint program with SDSU. And I'm gonna try to do this as clear as possible because I'm not very good at public speaking yet. But so as a woman and a member of a minority community, I'm Hispanic Latino. I come from a background of low-income family. And my experiences back in my country and in here in the US has been really being faced with challenges that have I've been challenged to make my voice heard as a woman, as a Hispanic, as a Latino. And I have aspired to obtain a higher position where I can advocate for what I believe and for my people. And now as a first year student in a PhD program, I see that there's potential to implement new strategies and really advocate for what I believe. But my past experiences, I think, have made me doubt about when or how to introduce the ideas to advocate for my community and the people that we serve. If I may ask you for your advice, what message do you have for graduate students that might be joining us that have these ideas of change and engagement and empowering our community, but we don't have the position or the voice, or we might not have that inside voice that tells us you have the power and it's possible that you might get in trouble. So to all the students, I think we all have that feeling at the beginning of our careers that we don't have the power to say something and we don't know when, how, or to who to speak out. What advice would you have for us that we're just beginning in this long path? And because this talk, believe me, it's really, really important for all the students and it brings us so much power.
Thank you so much for your comment. I think the answer lies in the comment that Nadia made about building your own community, about finding like-minded people. And Twitter has a lot of potential, a lot of opportunities to offer. And I made so many contacts, or so many, I would say even friends now that I found on Twitter and social media. And you learn through those conversations happening. It's not just about, it's not like hello, hi. It's also about how you see people having a conversation, having an intellectual conversation, how they discuss things, how they question things, how they challenge things. I think that's one way of doing it, finding people, finding your own community, whether it's in your institution, whether it's on social media, building your own community. But I think it's also important to find a mentor as well, someone who can really guide you and advise. It's really, and you're right, it's very critical to understand when do you speak and how do you speak and how much can you really question. It takes time. You cannot be really, you cannot go hard from the very first go unless you are in a position of power, and because that power imbalance brings a lot of violence. But if there is an opportunity for you to find a mentor who thinks along the same lines, who is not a conformist, and if there are people you think who you can connect to on Twitter or social media, or if you want to join a collective like Action to Decolonize Health, this I'm part of, maybe there are opportunities, and there are other student decolonization groups as well. I know it. I think there's one at Duke. I'm not sure if UCSF has one, but you will find opportunities. You will look for someone who can guide you along those lines.
Thank you so much.
Yeah, thanks, Maria, for that, for your frank perspective. Really appreciate that. We're almost at time. I appreciate it's very late in the evening for you, Muneera, in Pakistan. So I just want to close by celebrating and acknowledging with deep gratitude your wisdom and insights today. want to refer to some of the things in the chat and just echo the comments that have been made. Elizabeth Buttrick has written just how insightful your presentation was. Thank you for bringing us back to grounding our work in empathy. And Mo has highlighted your paper and presentation are really at the heart of deep decolonization and research and community well-being. And I'm sure many of others on the call today would really echo those sentiments. So thank you so much for coming and bringing your perspective. Evidence is not enough. The genteel world of debate is not enough, as you quoted in that last slide. We need to challenge power and speak up. And I really appreciate that sentiment, combining that sort of that boldness with empathy and humility. Thank you so much for being with us today, Muneera.
Thank you very much, Mike. It's been a pleasure and honor to be presenting here.
Yeah. We are at time, everybody. Let me thank all of you for attending too. It's so good to have so many of you interested in this topic, and I think it elevates the importance of our shared responsibility in this space. As a reminder, these sessions happen every month, the third Thursday of the month. In February, we have a colleague from Gaborone, Botswana, Dr. Corrado Canseda, who will be speaking on hierarchies of quality in global health partnerships. He's done some really interesting research looking at quality of global health partnerships. I'd encourage you to come and attend that presentation. Today's presentation, as are all the other presentations in this series, are available on the UCSF Institute for Global Health Sciences website. We encourage you to check out other presentations from an incredible host of speakers that we've been privileged to have come with us. But let me close again by thanking Muneera for her time, thanking all of you for participating in this rich discourse, wishing you a happy Thursday.